We'd like to welcome Dr. Tamar Tambeck here from McGill University in Montreal, where she works in the Division of Media, Technology, and Culture. Her PhD is in Art History and Communication Studies, and her dissertation was on performative autopathography's self-representation of physical illness in contemporary art. She has history in dance, she has history in theater, she has history, art in her background, and she is also a polyglot who speaks 5 languages. I got to sample some of those languages last night, and it was completely clueless. So tomorrow, I hope you were kind in what you were saying to me, but I'm really welcome.
Mainly be speaking English today.
Good. Welcome.
Okay, thank you. Thanks to everybody for taking the time to be here. It's a great opportunity to really get to know you and your campus. I'm standing just because it was technologically the more feasible place to be, but I hope you can all see me and see the projections. So you might hear me say this at a couple of occasions, but I wear 3 hats, and that's what I'm bringing to your campus, are 3 different hats. One is what can really just evoke my background in art history and media studies, and my focus on autopathography. The second one that was not mentioned is that I was a clown in healthcare environments for 5 years, in a variety of healthcare environments, from pediatric to adults, hospitals to long-term care facilities for elderly people, to rehabilitation centers and so on. So that aspect of my background won't come up in this academic presentation, but it might show up a little bit tomorrow in the teaching presentation for those of you who might attend that. And yeah, the third hat is research that I'm doing right now on contemporary art practices in healthcare spaces that are not conducted within a therapeutic context. But I'll speak about that more tomorrow. Today, I'm going to be talking about selfies of ill health, online autopathographic photography, and the dramaturgy of the everyday. So amongst the many new trends of online self-portraiture that have arisen thanks to the ubiquity of smartphones, the rapid increase of data storage capacity, and the proliferation of image-sharing platforms, representations of illness have especially gained an unprecedented public presence. So these selfies of ill health, as I call them, are surprisingly wide-ranging in scope. Broadly disseminated images include a number of celebrity hospital selfies, like this one of a pouting Miley Cyrus, a bikini selfie by an aspiring model showing her 2 colostomy bags, a selfie video of a stroke in progress, and trends such as the hashtag no makeup selfie trend that was purportedly being used to help raise cancer awareness. And notwithstanding the widespread tendency to pathologize the very phenomenon of taking and sharing selfies, accusations of narcissism and the like, I contend that it is fair to affirm that selfies of ill health now constitute a significant incarnation of the autopathographic genre, given their variety and breadth in online spaces. So for those, I imagine many of you are familiar with this term, but just in case some people are not familiar with this term autopathography comes from literary studies and refers to a subgenre of autobiography in which the life narrative pivots around an experience of illness, an accident, or trauma, which is why the root word bios in autobiography is replaced with pathos in autopathography. So the bulk of my research has been to extend the use of this term to look into visual and performative self-representations of the illness that offer a first-person perspective on what it might be to experience illness or hospitalization. And today, what I'm going to be presenting is a preliminary investigation into the manifestations of autopathographic practices in social media, namely selfies of ill health, which I will argue are on the one hand anchored in older pre-digital forms of autopathographic performative photography, but that bring new outlets and new purposes for autopathographic practice thanks to the specific affordances of social media. And I'll give you very concrete examples of that in a moment. So my talk is divided in 3 parts. In the first, I'm going to give you a sort of lay of the land to give you a sense of what kinds of selfies of ill health are out there. The second part will be situating selfies of ill health along this lineage of an autopathographic genre that would have gone from professional photography and high art practices to this very vernacular lay medium, which is the selfie, which anybody can take. And then the third part will give you a much more focused reading on what could be regarded as a case study of a woman called Carolyn Gehrig's work. And she launched a #HospitalGlam movement and developed a selfie series around that hashtag. And I will argue that her production sheds light on both the personal and the political stakes that are at play when one discloses one's health condition publicly in an online forum. So as social media scholars Terry Senf and Nancy Bain have noted in their pioneering review of this so-called global phenomenon, the selfie is not merely a photographic object. It is also a practice, a gesture that can send and is often intended to send different messages to different individuals, communities, and audiences. And so even within the specific category of selfies of ill health, I'll propose that there are a number of discrete subgenres that can be distinguished both in terms of their subject matters and in terms of their communicative intents. So a first such grouping of selfies of ill health, which I'll actually almost evacuate from this discussion right away, encompasses selfies whose appearances and purposes are essentially the same as those produced in any other environment, except for the fact that these images might contain clues that they are taken in a medical environment or that they might address a medical condition. So we're talking about medical furnishings in the image, or maybe a patient's hospital gown, for instance. So these selfies, as we can see here, reproduce the familiar poses and framings of selfies at large, but without any apparent modification that might be attributable to the experience of illness or of hospitalization. So although such images may be tied to a medical experience, that experience hardly appears to inform the image, let alone direct it in any way. So in other words, a selfie that is taken by a patient in a healthcare environment does not necessarily amount to what I'm describing as an autopathographic selfie. A second grouping of selfies of ill health circulates amongst online communities in order to promote or offer support for behaviors that are generally deemed pathological. So examples of this would be images that are shared on Tumblr in support of the pro-Ana or pro-Mia movements and supporting anorexia and bulimia, and that's one of the reasons why I'm not showing those images. And self-injury photographs circulating on Flickr. So setting aside the difficulties in addressing the very subject matter of those images, one thing that should be noted is that they're generally addressed to people who have an interest in those health conditions or those behaviors, whether it is because they themselves are partaking in them or because they're curious about potentially trying them out. The third category of selfies of ill health serves to acknowledge the impact of illness or its treatments. And I'll show you a number of subgroupings within this last category. The impact of illness or treatments on the subject, on the patient. So these images are often circulated for the benefit of peer education, but in contrast to the previous examples of the pro-Ana, pro-Mia, or self-injury photographs, they're not necessarily intended to only reach like-minded communities or communities of patients experiencing the same conditions. So images that fit within this category include what I've called diagnostic selfies. So here we have an example of Stacy Yeats, who in 2014 took a selfie video as she was experiencing numbness on the left side of her body while she was in her car. And with this selfie video, what happened was that the first impact was that it helped her medical practitioner to actually accurately diagnose what she had been complaining about for a few weeks, which was the fact that she had undergone a mini stroke. The second impact was that once this selfie video was shared on YouTube and then picked up by the press, in Canada at least, it then was covered in such a way as to provide broader community education about recognizing the signs of a stroke. So it had those dual functions, diagnostic for the medical professional, but then a larger public health education function indirectly through the intermediary of the media coverage it received. Other forms of popular education selfies include what I'm describing as cautionary selfies. So these are photographs that are intentionally circulated as a warning to the public. So here we have an example of a selfie that was widely disseminated and shared. It was posted in April 2015 by Tawny Willoughby, and it was posted on Facebook, and it shows facial scabs that are the result of her skin cancer. And when she posted the image, it was accompanied with a comment in which she promoted the use of spray tan and sunscreen over tanning beds and sun exposure. So a cautionary tale, as it were. Finally, treatment impact selfies, like Laura Price's 2014 time-lapse video, which is composed of selfies taken daily over an 18-month period after she had completed her chemotherapy treatments, I would say also fall under this broader category of illness impact selfies that are shared for the benefit of peer education. This is what it can look like to undergo cancer treatment. So these categories give you kind of a preliminary glimpse or overview into this overarching genre of selfies of ill health. What I'll do for the rest of my talk is focus exclusively on that third category, which is images, autopathographic images that attest to the impact of illness or its treatments on the subject. And so I'll define that a little bit more specifically. In an autopathographic selfie, the representation of an experience of illness constitutes an integral part of the image's subject matter, but it also serves to publicly attest to the pictured subject's identity as an individual who is living with illness. So the public function, but the personal kind of the affirmative stance. So this form of self-imaging emerged alongside other products of what is being referred to as the Web 2.0 generation. So I'm thinking of the rise of e-patient communities and online illness support groups. However, autopathographic selfies can also be positioned in a lineage of earlier performative photography centering on the experience of illness. So current scholarship positions the practice of the selfie in the aesthetic line of the self-portrait and in a technological lineage that descends from automated photography that is enabled by devices like Polaroid cameras or photo booths. And while this aesthetic and historical positioning accounts in part for the selfie's characteristic subject matter, which is a picture of the self, and its production format, which is rapid, automated image capture and treatment, it doesn't take into account the fact that the web allows for an immediate and ubiquitous dissemination of the image instantaneously. So media scholars Alice Tiffindale and Lev Manovich have observed that these characteristics are so intimately bound with selfie production that they cannot be distinguished from its unique raison d'etre, in contrast to the self-portrait, for instance. The instantaneous and prolific spread of the selfie across multiple platforms and multiple social media platforms is integral to what constitutes its distinct identity within a broader array of self-imaging practices. A born digital genre, the selfie is not just an automated picture of oneself. The selfie is, per the OED's definition, a self-image that affords instantaneous sharing with myriad receivers, both known and unknown to the pictured subject. So photographic self-portrait, especially one taken with a smartphone or webcam, and shared via social media. So that's essential to the definition of the selfie. So by this token, the selfie is very much a publicly oriented picture of oneself that is specifically destined to circulate amidst the shifting ecologies of media environments and beyond the control of the emitter. The selfie is thus implicitly social, but since it is often directly tied to users' social media accounts, and I'm thinking of the instant connectivity of apps like Instagram to someone's Facebook or Twitter account, the selfie is also susceptible to appropriation and remediation, as in this example, where we see, so I had shown you the Bethany Townsend's bikini selfie showing her 2 colostomy bags. Well, Crohn's and Colitis UK said, let's make this a campaign to raise awareness about Crohn's and colitis, and let's invite our members, our friends on social media to reproduce that infamous selfie, and also to show their colostomy bags as well, and to remove the stigma and the invisibility of that health condition. So, given its wide, and I should also add that even when the selfie is used in a more fixed online form, like an avatar or a profile picture, the selfie remains what one art historian has called, with regards to the self-portrait, a technology of embodiment. And in this case, it's a virtual face or social interface through which users can engage with other actors, both human and non-human, bots and the like, that are surfing the web. So given its widespread sociality, the selfie offers a privileged means through which to continually explore the possible relationships between one's personal sense of identity and one's public self-image. And as I'm doing a bit of the media theory stuff, but we'll get to some more pictures soon, as media theorist Rob Cover has suggested, rather than seeing social media users' identities as fixed, static, and merely represented or expressed through online activities, scholars ought to consider the ways in which social networks operate as a space for the continued, ongoing construction of subjectivity, neither as a site for identity play nor for the static representation of the self, but as an ongoing reflexive performance and an articulation of selfhood. So in this optic, the activities that are undertaken in social media are not just reflective of or representations of the everyday performances of everyday life. Rather, they are the very spaces in which those performances essentially occur today. They count amongst those public spaces. And with its characteristic seriality due to frequent iterations and its insertion into larger forms of online autobiography or self-portraiture, like profile pages on social media, the selfie is a particularly apt site for investigating longitudinal performances of the self, whose discrete incarnations are interwoven between other photographic traces of everyday activities, from meals eaten to people encountered, places visited, or events witnessed. What most distinguishes the selfie from earlier forms of self-portraiture is the fact that this publicly oriented function of the image is already embedded within the very gesture of taking the photograph, given the immediacy and the potential breadth of its dissemination, and hence my framing of this self-portraiture as a type of dramaturgy in the title of this talk. The selfie crystallizes what Irving Goffman dubbed front stage behavior. But certain forms of pre-digital autopathography also conveyed a strong transitive intention, suggesting, and perhaps surprisingly so given their ostensibly taboo subject matters, that these self-portraits were emphatically meant to be seen by many others, and with the intent to show oneself in these autopathographic images, certain scripts played out that helped to determine not only what was to be seen in the image, but also how it ought to be interpreted. So here I'm going to give you a sampling of autopathographic imagery in the history of art. If we look at autopathographic images produced by professional artists, and I showed you this earlier on, this is the first instant I've encountered of an autopathography dated to the early 1500s. Albrecht Dürer's pointing to his abdomen and thought to have been sent in a letter to his physician while he was traveling. So for a remote diagnosis, as it were. So if we look at Albrecht Dürer through to the more familiar paintings of Frida Kahlo, to more contemporary works, Hannah Wilke and Günter Bruce, both performance artists but also visual artists. What we find is a recurrence of the subject who is shown in a frontal pose with a gaze directed directly towards the viewer, consistent with this willful intent to show oneself as being ill or in treatment. And such a pose, I would argue, carries a very demonstrative quality. It appears to say, I present myself or my body before you for you to observe, putting oneself on display with the signs of illness, either real or symbolic, or of ailments. And particularly in the context of breast cancer activism, being seen as sick or as having been sick was in part the very purpose of self-portrait images produced by Joe Spence in the UK on the right and Matushka in the US. And both these photographers specifically sought to counter the lack of visibility of this image outside of these images, outside of medical context, the lack of visibility of breast cancer. And they wanted to also produce images that ill women might relate to differently than pictures of cells under a microscope, or of a middle-aged woman wearing a wig and memory prostheses and having effectively evacuated the disease from her sight. So these are other forms of representations that they wanted to propose. And so in their respective autopathographic self-portraits, we can read performance artists Günter Bruce and Hannah Wilke, who were, of course, truly sick, not putting it on. We can read them as being ill through the medical paraphernalia that surrounds them. While Matushka and Matushka and Spence's scars on the breast become the visible indices of the past tumors that were once present and now removed. But in addition to offering indirect visual evidence of present or past ailments, explicitly autopathographic images that feature or announce illness as being integral to their subjects, explicitly operate as statements that confirm that these experiences should indeed be regarded as integral parts of the subject's lived experience, even when the subject won't necessarily give you any indication as to how that experience was lived. It just states that this is a part of my public self-identification. Does not give you any psychological insight necessarily into what the repercussions of that are. So this particular function of the autopathographic image, the deliberate inclusion of the signs of illness in the photographic accounts of oneself, can also be found in selfies of ill health. What is common to the vernacular selfie and to the autopathographic photographs by professionals is this communication of a decidedly willful display of the health condition on behalf of the author. And in a visual culture where non-medical representations of illness, such as breast cancer, were long excluded, the deliberate inclusion of signs of illness has been read by many as a very affirmative, if not an activist gesture. And yet, oops, there we go, I lost my slide. Oh, it crashed. I will restart. Excuse me for that. It allows me to take a breath, which is always a good thing to do. Allow you also to take a breath if you like. I'll go back to my stuff. So, here's the fun part. And yet, as I say, the cool frontality and the often impassive expressions that we found in the artist's autopathographic self-portraits lie in sharp contrast to the highly affected so-called duck-face poses that we have come to expect of selfies. And this is perhaps due to the fact that the selfie has a dual function. On the one hand, it is an icon of the self, and on the other, it acts as an object that is endowed with the capacity to negotiate, deny, or affirm group membership within social media environments and beyond. And nowhere is this duality clearer, I would say, than in celebrities' hospital selfies, which espouse the codes of these two seemingly incompatible impulses, which is showing one's ailing condition on the one hand, along with one's exceedingly mastered appearance. And in contrast to Matushka's production, which combined the very slick look of fashion photography to the sight of her mastectomy scar, these celebrity-type sickbed selfies all too often deny any specific value to the health condition. So a selfie, a celebrity selfie by any other name, is simply yet another celebrity selfie. The context might change, but this pose remains. And the same can be said for a vast breed of other selfies of ill health that are produced by non-celebrities who wish to emulate the celebrity life, a desire that, after all, is probably at the origin of the selfie hype. Like few vernacular media before it, selfie production combines the fantasy of artist Joseph Beuys's statement, "Every man's an artist," with Andy Warhol's prediction that in the future everyone will be famous for 15 minutes. And actually, Warhol himself produced his own hospital selfie, avant la lettre, in 1968, while he was recovering from surgery after having been shot. Holding a 35mm camera in one hand, he captured his bare-chested reflection in a mirror with a flash and inaugurated a hospital selfie pose that would unwittingly be repeated by countless others some 40-odd years later. And what's more, this image was processed and printed by Royal Tone Photo Service, which offered a bonus-size, wallet-size print, as if in anticipation of the present day's selfie's propensity to be distributed, albeit virtually. And so we see, 40 years later, Warhol's pose in these hospital selfies that are circulating online. So my partial perusal of the web suggests that the most prevalent types of selfies of ill health are point-of-view shots that show an injured limb or a body part, a hospital ID tag, or an arm that is attached with an IV drip, a PICC line, or in the process of having blood drawn. And many of the images that I encountered using informal keyword searches like #me, #selfie, #hospital, and so on, hold a purely documentary function within the subject's visual narrative of the self, stating, "I was here in the hospital, clinic, or ambulance," or "this happened to me," with this being the accident, the ailment, the trauma, the medical procedure. And here are some other samplings from there's so many of these images online. It's really interesting. Like, you see the selfie in the hospital is about what is happening to my body as I'm here, and sending out the message to friends or people who are falling to say, hey, for whatever reason, whether it's called for support or just say, oh, check it out, I've got blood, wow. Who knows? But these are very prevalent types of hospital selfies. And in fact, it's really interesting to note that many hospital selfies are not in fact related to long-term health conditions, chronic health conditions, but they rather are related to recent accidents or injuries, and that appears to be especially the case with the celebrity hospital selfies. But in contrast to such images, it appears that chronic or acute health conditions seem to generate further-reaching reflections on the relationship between illness and representation, and also on the social and political stakes of making oneself publicly visible as ill online, and as identifying oneself as ill or disabled as a consequence of illness. So for the last part of my presentation, I'm going to turn my attention to a series of selfies of ill health there that I find exceptional in terms of their capacity to rejoin the lighter sides of selfie culture with the more radical stances that we find in performance practice. All right, so for those of you who are familiar with modern and contemporary photography, you'll know that mise en scène, dramaturgy, theatricality, and masquerade are very well-established practices in professional photographic self-portraiture. Similar strategies, such theatrical approaches to self-display, were used, for instance, in the photographic autopathographies of Joe Spence on the left and of Hannah Wilke in the middle and right. Hannah Wilke, who staged herself with reference to historical artworks, in addition to poses taken from the worlds of fashion or popular culture. So here we see a clear religious reference to images of the Madonna, for instance. a performance artist called Bob Flanagan pushed this theatrical mise en abîme somewhat further by staging himself as a sick patient within a gallery setting. And so for the duration of this exhibition, visiting hours, gallery goers were invited to visit the real cystic fibrosis patient, Bob Flanagan, in a fake hospital room, entirely reproduced within the art space. And I'd like to say that the work of Carolyn Gehrig, who is herself trained in the arts, can be, and she's the instigator of this hashtag hospital glam movement that I referred to earlier, can be situated in a kind of hybrid lineage that descends from these artistic precedents as well. So on her Instagram profile, Gehrig identifies herself as a, quote, queer disabled artist and writer / Ehlers-Danlos syndrome / hashtag hospital glam. The subtitle on her hospital glam Tumblr page reads, "Taking the shame out of being in treatment, one selfie at a time." Media accounts have referred to Gehrig's health condition as a disabling chronic illness, not the words she would use herself. And they connect her selfie production with a desire to not feel invisible despite the invisible nature of her diagnosis. So Ehlers-Danlos syndrome, a chronic connective tissue disorder that can lead to a variety of other health conditions that require frequent monitoring. And so frequent visits to the doctor and to the hospital are a regular part of Carolyn Gehrig's everyday life right now. And so she began to document her medical appointments by taking selfies and also by planning special looks for these photographs, inserting a touch of glamour into her medical regimen, hence hospital glam. So as we can see here, these are examples in which Gehrig's presence is very much posed in these images. At times, she'll adopt this faraway gaze of fashion photography, for example, on the top and on the bottom here. In other instances, her direct stare into the camera is more reminiscent of the seemingly unrehearsed selfie genre, although it's rare that a selfie is not rehearsed. I just saw a bunch of them being taken at the airport on the way here. It's very interesting. That's a sociological phenomenon in of itself. The mask goes on and off before and after the selfie. And so one such seemingly unrehearsed pose consists in a before and after shot that shows Gehrig with and without pink lip gloss. And it's funny because the comment that accompanies this image on her Instagram page parrots the instructional rhetoric that you find in makeover blogs, for instance. But it's repurposed for the benefit of patient empowerment. So with a discernible note of camp, Gehrig writes, hospital glam tips, color makes an impact and draws attention to your features. If you are advocating for yourself, drawing attention to your mouth is not a bad thing. Go bold, you'll like it. And then a number of other selfies that she's posted emulate spreads in fashion magazines, for instance. And what we find in the comments is people write in and say, how did you get your lips to look that way? And so it reveals all the makeup application techniques and that she used and gives the names of the designers of her clothes and her jewelry, for instance. So really staying within selfie culture, in a sense. So how does this connect to autopathography? Well, just as an autobiography scholar, Laurie McNeil, has read 6-word memoirs, which are an online vehicle, as auto-tweetographies. And social media scholar Amy Morrison positions selfie practice as a form of life writing. So I propose that Gehrig's Instagram feed, of which we see an excerpt here, might be read as a visual autopathography. Her feed presents a loose analog in visual form to a written diary or journal that reflects and documents illness. So if we look at it from a cumulative, longitudinal perspective, so not restricted to a singular image, but rather as a series of images taken over a period of time, Gehrig's hashtag hospital glam selfie production finds itself woven into other elements that are recorded from her everyday life, such as dinner with friends or interactions with her dog. Her selfies of ill health punctuate the thread of images that are unmarked by illness and effectively insert her private and invisible health condition into the public online picture of her everyday life. So from this perspective, Gehrig's self-stagings on her Instagram feed can also be read as acts of coming out as being invisibly ill or disabled. And so in this optic, Gehrig's selfies constitute online political performance that have significant bearing upon her offline experiences as well. And so Gehrig's description of her process for taking these selfies in the doctor's office helps me to instantiate these claims. She explains, I find a place where I can set my phone down and I look through the viewfinder to see where the frame will be. Using Camera Genius, I set a timer to repeat at 10-second intervals and I turn off the sound. I step into the frame, sit or stand, however feels comfortable, and focus on my breathing. I count out 10 seconds between shots, figuring that I'm probably off a little. To me, it is extremely calming and centering. I am focused on how my body feels in space. If the doctor enters, and I am still doing it, I explain what I'm doing, that I've been posting the photos online to help reduce the stigma surrounding invisible illness. Then the camera stops, and we have our appointment like normal. When I get home, I filter and post the photos using the app VSCO Cam. So from her account, what we can gather is that Gehrig, in a sense, limbers up for the performance. But it's not clear from her account whether that performance is preparing for the selfie or interacting with the doctor. But it appears that both benefit from her quote-unquote centering experiences and her activities before, in preparation for this moment. So like an actor warming up, Gehrig's attention to her body and to her breathing allow her to be more present to her future selfie image, but also to her immediate experience within the doctor's office. One appears to inform the other. By photographing myself, she adds, I find some comfort in that space and I reacquaint myself with my body. By the time the doctor enters, I've checked in enough that I feel confident enough to speak about my concerns and take a more active role in my treatment. So Gehrig's performance before the camera allows her to be more at ease within the medical space, and while the texts that accompany her postings on social media emphasize the fact that hospital glam is an outward-reaching political intervention seeking to reduce stigma, raise awareness, heighten the visibility of EDS, what we find is that Gehrig's poses before the camera also serve her immediate personal needs, allowing her to be more attentive to her body, and in so doing, to take a more active role and take charge of the situation at hand in the waiting room or in the doctor's office. So like the artists before her, Gehrig's autopathographic pose constructs a particular dramaturgy. It is not only staged in order to be seen by others, but also to be read in specific ways that emphasize Gehrig's own sense of personal empowerment, even as she produces the image. The comments accompanying her photographs serve as the stage directions, in a sense, that orient our gazes in receiving her self-image. So one comment, annotating a photograph that shows her sitting in a waiting room, and you'll notice that her dress is magnified images of pills. I don't know if you can read that well here. One comment affirms, I'm quoting, having hashtag Ehlers-Danlos means my hashtag disability is often an hashtag invisible illness, and maintaining a visible presence in my non-disability communities while doing hashtag hospital glam has been valuable. I care for myself and I have no shame attached to the health issues that make up my life, unquote. What we find in this example is that there's a mutual reinforcement between comment and image, and this is a characteristic of digital intermediality. And it confirms the specificity of Gehrig's work as selfie production as opposed to self-portraiture. So we have an interplay between images and words that are potentially generated by numerous authors, but rejoined through the use of common hashtags like EDS, like hospital glam, like invisible illness. And this allows for a broader discursive field to be opened up beyond the singular post, since Gehrig's photos can be inserted into a wider hashtag conversation. So while it's still anchored in a representation of the self, the selfie here becomes a point of entry for discussion amongst people who identify with very diverse communities, ranging from EDS patients or disability advocates to fashion and jewelry aficionados, for instance. And on the subject of the invisibility, the interplay with visibility and invisibility, a lot of her selfies play with the dubious visual legibility of her illness. So on more than one occasion, we find her blending medical accoutrements with fashion accessories in such a way that they cast doubt upon their mutual identification. So the black web necklace gets lost amongst these cords, and her silver finger splints are also lost amidst an array of jewelry worn on her hands. So in confounding their appearances in this manner, one wonders whether Gehrig's trimmings are the products of artifice or a necessity. Where do the medical aids end, and where do the fashion accessories begin? Now, Gehrig's production, as I mentioned earlier, is certainly not a representative of the majority of existing selfies of ill health, either in its sophisticated form or, I would say, in its more radical intents. Nevertheless, although hers might remain a singular voice, the call for participation that was instigated by her #HospitalGlam movement has prompted unsuspected avenues for creative self-expression by other patients, primarily young women, as evidenced by the numerous reposts we see on her Tumblr page. So basically, people send in their own #HospitalGlam images. Gehrig's images also function as patient-centered counter-representations to the medical and diagnostic pictures that also populate the web, such as those now circulating through the Figure One app. I don't know if any of you use this by any chance, which is dubbed as the Instagram for doctors. So these images reproduce the conventions of medical textbook photography, showing afflicted body parts in isolation after having removed any identifying marks from the depicted individual. Whereas the doctor's images aim, of course, to protect patient confidentiality, Gehrig and other partakers in #HospitalGlam seek, on the contrary, to affirm their identities as individuals living with illness. Their public proclamations of ill health are achieved through the inclusion of recognizable health-related contact in the image, or through the appendage of contextual information in hashtags, metadata, comments, etc. So in this respect, selfies of ill health do draw upon the specific affordances of social media in terms of their production and dissemination. However, their communicative intents remain consistent with earlier forms of autopathographic representation, both in the visual arts and in narrative forms as well. The dramaturgical thrust of this imagery is to convey both the centrality of medical experiences in the subjects' lives, as well as their specific desire to be publicly identified as a person living with illness.
We have about 5 or 6 minutes for comments or questions.
Has the medical community at all engaged with this woman, Gehrig?
Well, they are very much so in terms of her treatments.
No, but I mean in terms of what she's doing in terms of HospitalGlam.
I have not seen any. This is part of an article that's coming out soon. I have not seen any scholarly writing on her work or on selfies of illness. The scholarly literature that I've looked at. In fact, there's no equivalent. There was research on #funeral selfies, and there's research on self-injury photographs on Flickr, and research to a certain extent on the pro-ana, pro-mia type of images circulating on Tumblr. There are then analyses of user-generated cancer narratives on YouTube.
So I guess I was thinking more, so patients have reposted her stuff and responded to her. I was just wondering if healthcare providers were responding to her.
That's interesting. Methodologically, it's a challenge to be able, first of all, if they don't self-identify, it'd be a challenge to figure that out. The mandate, if you will, of HospitalGlam is a forum for patients. So she's giving priority to patients across the board. Whether or not she engages in a dialogue with her doctors, well, apparently she does, because if somebody walks in on her taking a selfie, she tells them right away, I'm posting this online. My intent is to reduce stigma, heighten visibility, and so on. So she articulates that herself. But in terms of having an online dialogue, I haven't come across that. I haven't asked her about it either. I did interview her before going ahead with publishing any of this.
Have physicians commented on this? Is that sort of what you're asking? Have physicians publicly commented on her project?
No, I haven't come across any comments from the medical community at all. No, it's really garnered it's garnered attention in the social media and then in media.
So I guess the question is for those of you that are relevant in the room. I mean, what if she was your patient? What would you think if you walked in or taking selfies? You know?
Yeah.
What would your reaction be? Would you consider this positive, or would you be sort of intimidated by it a little bit?
The question is whether it's therapeutic for the patient or an art form that's demonstrative, performative, and not therapeutic. Do you know?
But one is not necessarily, one does not contradict the other. Yeah, exactly.
I think there is this experience as a patient of not wanting to suffer in isolation and being anonymous, which is in direct contrast to physicians and the medical culture in general, trying to keep everything anonymous. I mean, we value protecting anonymity way over like trying to limit isolation.
Yeah. Yes, absolutely. And of course the social, I mean, the reason why I brought in a lot of media theory is to say, if we don't use social media so much in our lives, we may not give it accord it the space that it takes up maybe in younger people's lives. That's very much part of their cultures. That it's real, it's tangible. Even if it's virtual and digital, it's real. It's a proper social space. It's like a courtyard or a cafe. It exists. It's meaningful to them, and so on. So that aspect of sociality very much comes into her work. And yes, and I mean, the thing is with selfie culture, it's full of these paradoxes also. I mentioned 15 minutes of fame and everyone's an artist. In her case, she is an artist. She's a trained artist, and that's what makes her production not so representative of selfies of ill health at large. But it's an interesting case study because there's that friction of, on the one hand, knowing how to use images and also knowing how to use social media. Knowing how to put in those hashtags that might, if somebody's into, I don't know, a fashion designer or someone, they might come across her production just because they looked up the fashion designer. And so that way the image circulates beyond the medically related community online, let's say.
I was involved once in a project that was called How to Talk with Your Doctor, where we were doing community forums of patients to try to get them to be more active participants. And one of the things we really ran into, we had this sort of mnemonic ABC, ask questions, be prepared, communicate your concerns. And one of the pushbacks from the patients was, I understand what you're saying, that if I ask questions, I'll get my questions answered. It's not my place to ask questions of the doctors, who realized there were these various sort of taboos that the whole project shifted to be less of an education project and more of an exploration of what were the taboos and how close could you go without going over before it became emotionally too hot. And I guess what I find so intriguing about this is that she seems to be looking for the taboos. You don't play with the equipment in the office, right?
Right.
And so I find myself wondering, to the extent, it's really interesting. I've met several of the more popular e-patients, and they strike me as being very active participants. And the question is, if we can make the taboos visible, then we can start asking the question, what's a line I personally can't cross, and what's a line I can cross? Where are those lines?
Yeah, absolutely. I think, you brought up e-patients, and I think that's really changed also the sense of who's got the authority in the room, right? for better or for worse. I'm sure that many of you aren't so happy when Dr. Google is consulted, and with reason. But yes, of course, you know, the e-patient movement is so much about empowerment and seeking knowledge for oneself and amongst the community of experts who are the patients who have gone through these experiences. And so there's a middle ground to be found, for sure. But I think we're still in a period of transition because not everybody is digital native, and so that's a culture. It's a cultural question too. Just like different cultures have different relations with authority and whether or not they would even dare to ask a question to a doctor. I think also this generational and technological shift is bringing with it a change in culture.
So interesting on so many levels. The process, what to do with it all. You know, part of what this seems to me is that it's a movement of people trying to control the narrative of their illness, and it's a way of the patients, or maybe they would call themselves the individuals taking control over the story that of their illness, and it's a very different story than clearly a doctor would tell about somebody's illness. I mean, no doctor would sort of depict the experience this way. And so that's kind of interesting. What I'm struggling with is you seem to de-emphasize the narcissistic aspect of it, which some people just really want to have everybody look at them.
Yes.
And some people don't. And I don't know what to make of that. I mean, I know it personally makes me uncomfortable, and maybe that's the goal of it. But it's so much part of that culture of look at me, here I am, and and I want everybody to take notice of me. And so what do you do with it? It's not a universal generational thing.
No.
By any
That's
means.
true.
I mean, I think about my own kids who they don't use social media. They're completely disinterested in it, and they're like, this is not. They just don't. It's not their thing. They're just like they don't want anybody posting any pictures of them ever.
Yeah.
They're very private. And,
probably aware of the dark sides of.
Well, maybe, and it's just they're just not
right?
interested, and so.
Well, maybe I can say two things
Sure.
about that. The first is, I mean, you said it in a nutshell. This idea of taking control over one's narrative. That's why I say there's so many continuities with other forms of autobiography, illness narratives. You are integrating the experience of illness into your account of your own life, and that's in a way through that process of narrativization. You are making it part and parcel of your picture of yourself, how you see yourself, how you see your life path. There's been some contestation about whether, I think medical sociologists talked about illness as a biographical disruption, and that's, I think, is a contested notion. But one of the arguments was that autopathography is a way of constructing a new life narrative with or after illness. Yeah.
If the idea is for the patient to take control of their narrative, what are you doing? Like, are you co-opting the patient's narrative?
I'm looking at this, trying to understand what is the function of these images. I'm not going to make any pretext to know Carolyn Gehrig's intentions beyond what she explicitly states. I don't read into her psychology. That's not my job as an image scholar, media scholar, or as an art historian even. So I don't do that. I look to her accounts of what she does, and also I had a chance to interview her. She looked at the paper that I wrote as well. And she, on certain things she might disagree, but she sees that I'm positioning her project within a larger series of practices with images. And I'm trying to understand, where does this fit in within the ecology of selfies, which, you know, are, for the reasons that you brought up, you know, are a puzzling phenomenon. And I think, I mean, I tried to bring up those contradictions, you know, this idea of the 15 minutes of fame and so on. I think that's so much part of the selfie culture. But that's also a way of socializing for some people, and that's legitimate, you know. Some people can choose that and some people cannot.